Hi everyone, my name is Julia DeGrazia, and this is my presentation on preparing nursing students for technology-rich healthcare environments. So, technology is present not only in our everyday lives, but also in healthcare in both the academic and clinical settings. These changes and developments are apparent in not only the devices that clinicians and students use, but also in the charting and communication systems known as electronic healthcare records or EHRs. It's been becoming increasingly more important for nursing students to be educated on the use of technology and be comfortable with it as it affects their future work environment. So, authors Hussey and Hannah in 2021 created this helpful timeline that shows how technology has been influencing and supporting healthcare and professional nursing practice. And it starts, even way back here, back in the 1950s when computers were first being incorporated into technology, and then up to today where we have complete digitization of all of our systems and EHRs. But going back to about 1983, that was when Dr. Marion Ball introduced the term of nursing informatics originally, and she had described it as the use of information technologies that relate to to nursing duties. But today, in about 2023, the American Nurses Association defined nursing informatics as the integration of nursing science, computer science, and information science to manage and communicate data, information, and knowledge and wisdom in nursing practice. So, attitudes about technology and healthcare really changed in about 2009 as part of President Obama's stimulus package. One of these was the High Tech Act, and that encouraged healthcare systems to adopt standardized EHRs, and this was mainly through incentives with an overall goal of improving health outcomes and lower healthcare costs. Now, Kadikia from 2021 reviewed that this really helped fast track the U.S. into investing into EHRs. But in reflections and hindsight, it wasn't a completely perfect service, but it really encouraged the U.S. to look into future developments to modernize these data systems. And this helped better equip themselves to handle modern problems such as the COVID-19 pandemic. And Billings and Halstead in 2021, our textbook, referenced how the 2011 Institute of Medicine's Future of Nursing report suggested that nurses must be educated in master technology systems, as that will affect emerging nursing technologies such as genetics, EHRs, which includes the physician order entry and documentation, communication, as well as updated diagnostic tools and treatments. So this greatly impacts the classroom setting as nursing faculty now must integrate the use of technology into their teaching, whether that's through computer-mediated courses that allow for flexible asynchronous learning and the use of simulation technology, which I'll talk about a little bit later. But Billings and Halstead describes how teachers, especially in higher education, must incorporate technology as the sole reliance on strictly lecturing is almost an obsolete practice and basically no longer an accepted method of teaching. Kowitalaku from 2022 aimed to explore students' engagements and learning motivations using EdTech. And EdTech is defined as the study and ethical practice of facilitating learning and improving performance by creating, using, and managing appropriate technological processes and resources. They found that students were most engaged with gamification, which is basically technologies like Kahoot, where it's a game or with like ranked prizes, essentially, not prizes, but rankings to make it engaging, competitive, and overall challenging for students. But this also reminds educators that they need to balance the use of technology with also the caring and holistic aspect of nursing. Because if a nurse is only present at the bedside charting and not paying attention to the patient in an empathetic way, we kind of lose the entire focus of nursing as well. So it's important for educators to balance that setting as well in the classroom. So now on the clinical side of it, students need to be prepared with psychomotor skills, whether that's using EHR in clinical settings. They need to have the knowledge of the technology and at least a beginner's ability. This is used to acquire patient information, use it to plan care, and document assessment findings, noted in the Orman textbook from 2018. It also describes how psychomotor skills require neuromuscular coordination, and basically they need to be able to perform skills proficiently, smoothly, and consistently under varying conditions. And that is really beneficial, such as simulation and even health assessment and fundamentals labs, where students actually get hands-on experience using some of the machines that they'll be using in clinical practice. The article by Alt Miller and Pepe from 2022 described how COVID-19 pandemic, both seasoned nurses and new graduates were forced to face a steep learning curve and adapt to new protocols and technologies. Nursing educators use skill labs, such as the ones that they did in undergraduate, to allow for nurses to have these hands-on opportunities to learn how to safely use equipment and acquire new skills and practice in an unhurried and safe environment. Now, the issue with in nursing school is that does it prepare you overall or just for specific devices? Even an example with the EHRs, different ones such as Epic, Cerner, Meditech. If students are only learning how to use one system, then they might not; those skills might not translate into different systems, as the charting is very different. But overall, students should have a general understanding of technology and these EHR systems and different types of pumps because that will aid in them learning how to use other devices more quickly. So, some long term impacts of preparing students for these technology rich environments is that there's always going to need to be continued education for both educators and students. And we would also hope that the timeline that education advances is similar to that of the clinical side. So, if clinical sides are using these brand new devices and nursing educators are not preparing students for these new devices, there's going to be a bit of a learning curve once they get into practice. And then we know that technology offers us, fast, accessible, up-to-date information, and this could increase productivity for nurses. That's from Orman et al. From 2018. We just hope that nurses are also being educated on what resources are reliable and acceptable to use. So it's important for nursing educators to also educate about that. And educate them early on in their use. And then we also want to make sure that we are not teaching students to rely on technology. They still need to maintain their, proper assessment skills, as well as what I talked about earlier with maintaining human empathy and compassion. Jansen et al., an article from 2022, actually describe or try to describe how nurses gain this gut feeling that would show or they would be able to detect pediatric decompensation on a pediatric floor in a hospital, and that's apart from just their vital signs or clinical presentation. So it's important just to always emphasize nurses' gut and their own experience, not just what the technology shows us is using. So, although basically all of the NLN core competencies can be applied to preparing students for technology rich healthcare environments, the ones I thought mostly stood out were one, two, and four. So, for core competency one, educators need to create engaging and effective learning experiences that help students build competence and confidence in tech driven environments. And then core competency two, educators support students in adapting to their professional roles, and that would include developing critical thinking skills and when using digital tools in patient care. And then competency four, nurse educators need to ensure that course content includes up-to-date tech competencies and assesses nursing students' ability to perform in the real world using technology. So, in any academic program, DEI or diversity, equity, and inclusion is extremely important. And nurse educators need to recognize the different groups of students that they might have and the barriers affecting these different groups of students. That could be anywhere from financial resources, different academic preparedness levels, and language skills. And that's from Billings and Halstead from 2020. And then in connection with technology use, it's important for faculty members to consider the cost, connectivity issues, privacy, confidentiality concerns, and overall student comfort with using these devices if they're requiring them for their classes. That's from Orman et al. In 2018. Strategies to effectively implement technology include early introduction, opportunities for students to practice and train with these, and then also clinical teacher role modeling, and also offering support for students as needed with these tech issues. And then, for example, if a student or a class is going to require the use of a high tech laptop, maybe with a camera or a certain computer program that students need to buy, maybe the school should be the one purchasing that and then distributing it to the students, as it might be part of their tuition instead of an individual cost. So something I thought that was extremely interesting from the Billings and Halston textbook was they examined ages from millennials to Gen Z and how that could affect students using technology. And millennials, they're tech savvy, but not as much as Gen Z, where they're avid tech users, but they tend to absorb info quickly and then just lose that interest right away. Gen Z is also distinctly tech focused, and that's different from how educators who are currently in practice may have been taught. And it just shows how modern and emerging tech tools need to can promote learning and bridge these gaps. Delora et al. Was actually a really interesting study from 2024 that was a cross sectional, multi center study aimed to determine students' attitudes towards technology, specifically focusing on their enthusiasm and then also anxiety related to using technology and the factors associated with those. And the study actually found that the older students were, the more anxious and less enthusiastic they were about technology. So in a clinical setting, or even simulation, health assessment labs, educators can remember this and maybe have older adults, take some more time to practice adjusting to using the technology or the charting features associated either with the job or the task at hand that educators are asking them to complete. Now, I've touched on a lot of the advantages and disadvantages of using technology to prepare nursing students. But some of the advantages again, improved clinical preparedness. Nursing students can be more efficient, enhance patient safety, especially with new nursing students, through things like barcode scanning, and then of course the opportunity for asynchronous learning and also self-learning. Nursing students can go look up more information on their own outside of the classroom. Some disadvantages is cost. Educators need to be familiar with the technology that they're teaching, and then also the concern for the lack of human interaction and empathy, and then also the potential reliance on technology, which I'll talk about a little bit later as well. And then Billings and Halstead from 2020 also kind of warned that as computer technology advances, so does the opportunity for cheating or academic dishonesty with the use of smartphones, cameras, and just overall inappropriate computer use for exam or homework assignments. So, one short term strategy that educators can use to help prepare students for these environments is the use of simulation. Now, although it could be beneficial with more advanced technology and other simulation materials, immersive simulations can be done at any time, even in a typical regular classroom setting. And Billings and Halstead from 2020 describe how nursing educators can use certain guidelines to implement simulations into nursing courses, with some of them quickly just being specific objective time limits, the need to orient nursing students to the simulation labs, assigning roles, especially early on in nursing students' experiences with simulation, And then making sure that we're limiting interruptions. It's an appropriate skill level task for the level of the nursing student. And then it's also important that the faculty knows a lot about the simulation, as well as emphasizes the importance of debriefing after a simulation attempt. And that would aid in learning for next time. And overall, simulations are used to produce a realistic but low risk environment for students to practice in. And that's from Orman et al. In 2018. And then a systematic review by Park et al. In 2024 found that when compared with traditional learning methods, immersive technology such as simulation showed that it's more effective in improving undergraduate nursing students' knowledge attainment, competency, and self efficacy. So this is actually a YouTube video I tried to embed of a nursing simulation from Montgomery College School of Nursing about a code blue that students were supposed to respond to actually from a lecture. However, it's not letting me play it on PowerPoint. So hey, I'm a nurse. I'm gonna help him. Hey, Mr. Bauer, can you hear me? Mr. Bauer, can you hear me? Are you okay? I'll start ventilating. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So basically, it's just a quick video to show how students are able to practice these simulations like in a Code Blue situation, which they might not get to see or, of course, be a part of in a clinical setting. But they're able to practice, the roles. One of the nurses students said, "I'll start ventilating," and then other help bringing in the code card. And this is an experience that is unbeatable because once it happens in real life, you really need to know what to do. So thank you to the Montgomery School of Nursing for uploading this simulation attempt. So one long-term strategy would really be to incorporate education about technology into the curriculum. Instead of just focusing on one class of nursing informatics, educators can gradually incorporate nursing technology into the program. And that could be, whether it's starting in the first year, just introducing basic EHR navigation to the final year where students are, required to fully be able to, maintain a simulation with a mannequin and different devices, or just, using health informatics data as well. The literature review by Abedelzi et al. From 2025 highlights the need for nursing programs and hospital training programs to incorporate more training related to advanced technologies. And it was a literature review of 10 studies that just really emphasized how training needs to be implemented early to ensure that once graduated nurses are proficient in handling these advanced technologies and comfortable, especially when lives are on the line. And then the review also encourages that nurses be educated on using technology that's ethically appropriate, is effective, and responsibly integrated into the nursing practice. So, once again, not just relying on it, but also developing their clinical skills as well. So, cost is always going to be a huge external factor that nursing educators as well as students are going to have to worry about. Nursing educators are really going to have to evaluate the cost benefit ratio of the technology that they're using for teaching, and if that cost is going to be relayed onto students, just making sure we're prioritizing what technology is really useful for students and what can be held off for now. Other government policies like high tech and even HIPAA. HIPAA has huge concerns for privacy along with technology use. We want to make sure that students are educated on using technology appropriately and maintaining patient privacy data. And then, other words, like again, if another bill was passed by like high tech that forced us to kind of shift into a different form of EHRs or anything like that, or more usage of AI. And then, of course, AI, we have to worry about environmental concerns as there's increased energy consumption and could really affect the planet as well. One thing kind of separate that I would like to focus on is the vulnerability of technology. We need to prepare students to be equipped for these technology rich environments, but it's also important to educate students and prepare them for if these systems fail or are inaccessible. Nursing students need to always know how to do med math and calculations and dosage calculations and mixing different medications on their own. They need to be able to talk to a provider using an SBAR format on the phone, maybe instead of being able to send, a text, and then just being able to write their own nursing notes and assessments as well. And healthcare systems, according to Gates 2024, are the number one victim of cyber attacks, and that cost hospitals millions of dollars for downtime. And downtime could be, when computer systems are completely inaccessible. Nurses need to go back to paper charting, bringing out whiteboards to keep track of patients, stuff like that. And nursing students really need to be educated on how phishing schemes and what happens if they don't use the internet properly, especially on these hospital computers. And breaches in data could lead to altered treatment plans, errors in monitoring, especially when it comes to ICU devices, and then just of course leaking patient data as well. And that's from Aldosari 2025. So overall, I really enjoyed doing a lot of research on technology and how it can be useful in nursing education. I personally have a huge draw to simulation. I feel like it is the future of nursing education for both clinical practice and on the academic side. I would really like to explore more of that one day, hopefully, as my future role as an educator. I just think it's a perfect opportunity for students to be able to practice and make mistakes. And one thing that I've always loved about education simulations is that my hospital at least starts every simulation with the phrase like we all acknowledge that we are here to learn and that everyone is trying their best and it's not a judgmental environment. So you just really assume the best about everyone there trying to learn. Another thing that I found really interesting was from the Billings and Halstead textbook was that when they mentioned that lecturing is basically a near extinct practice. In my undergraduate experience, I had a microbiology teacher who was infamous for strictly lecturing. And if you did not get one thing that she had said out loud, you got that question wrong at the test. And she did not provide any form of notes, anything like that. You just had to write down every single word she said. She was an older teacher, of course, and this actually greatly changed during the COVID-19 pandemic when she was forced to then lecture online. She had actually reached out to me, and I was able to provide her my nursing notes or my notes that I took for that class. And she then distributed these notes to her future students as basically the form of a PowerPoint, which also they had mentioned was basically obsolete. But it just showed how much an older teacher had to adjust and redo how they had been teaching for probably 40 years because of the pandemic. And then another thing I know I mentioned, I was really interested about how downtime works. And I had my own personal experience with hackers. I was actually working at GW Hospital in DC in 2020 when they were under a cyber attack. And we had a function for multiple days before service was eventually restored. But there were just signs over computers like do not use. We were doing, handwritten charts, everything like that. I was at tech at the time, so I can only imagine how stressed the nurses were to maintain all their charts, especially with medication administration, stuff like that. So I think it's really, really interesting. And we in my hospital currently we practice downtime at least once a quarter, where we truly bring out a whiteboard, and that was actually in the ER where that would happen. And just trying to keep track of ER patients on a whiteboard as they go to different scans and whatnot. It truly is a completely different practice of nursing, and something I think students will definitely take for granted today, which is why it's really important to, of course, educate them on the benefits of technology, but also just knowing how to function without it. So, thank you for listening to my presentation. And then this is the list of the first half of my references. And then the second half of my references. Thank you again for listening to my presentation. I hope you enjoyed. My name is Julia DeGrazia. Thank you again.